thank you to the faculty and the students who I met with earlier for the really great discussion, and it's amazing to see such energy around this issue. Not on this campus only, but in campuses throughout this country. It's an honor to be given this lecture in memory of Carole Samuelson, who had one of the toughest jobs in public health. There is no more difficult job than being local public health director and state health officer as well. It's a lot of respect for Carole and the work that she did, because that's not easy work. For those considering public health, that's the pinnacle of difficulty right there. I have to make it known, while I do still work for the federal government, I'm here today on my own behalf. What I am going to present today does not represent the opinions of the CDC. It's my own opinions and mine only. So we cleared that legal hurdle out of the way. So let's begin with a little reorientation. A lot about climate change is difficult to engage in an intellectual way, because I think in a lot of ways we tend to distance ourselves from the magnitude of this problem. It is a tremendous challenge for this and future generations. And part of the problem is understanding the perspective that we need to take. Too often, when we talk about climate change, and me and other eminent climate scholars like Jim McClintock here, I'm nervous as heck to be in the giving a talk in front of, is the fact that we talk about climate change in long-term type trends, by the end of this century or in the next 50 years. And few people understand, and there's one thing that I want you to get from this 4-hour lecture, just kidding, is that this is a problem that we are experiencing now. It is not about polar bears and melting ice in the Arctic. It is about impacts we're feeling in our communities right now. This isn't something we can distance ourselves from in space and time. This is an image that I think does an interesting job of kind of giving us this perspective. These are two globes, obviously. The one on the left is a representation of all of the water on this planet. This is all the water in the oceans, in rivers, in streams, in lakes. This is all the underground water. This is all the water that's contained in all the biological organisms on the Earth. Contained in a sphere at sea level pressure, represented as an amount in comparison to the size of the globe. You would be shocked to learn that that there's this little water actually on this planet relative to the size of the Earth. Think of the Earth as a blue marble, but it really is not. We have a very limited amount of water on this planet. The image on the right is the same for the atmosphere. This is the entire atmosphere kind of compressed to sea level pressure and shown in relation to the size of the Earth. While we think, and we have the hubris to believe, many people do, that how could humans alter the basic chemistry of the atmosphere? It is so big. I've had many people tell me that. How do you think that the humans could make such an impact on the globe? Well, it's clear that we can. If you were, as another thought exercise with this, if you were to wanted to explain to somebody the actual thickness of the atmosphere, and you had a basketball, all you would need to do is wrap that basketball with a layer of saran wrap, and that would represent the thickness of the atmosphere. So we have a very thin blue line, which is what the astronauts saw when they entered space, that the atmosphere isn't this large, voluminous thing that we couldn't possibly contaminate. We absolutely can. And we know that by looking at ice cores, thanks to work by people like Jim. And this is a chart showing historical, this is going back in this chart 800,000 years, CO2 concentrations in the atmosphere that we know what that chemical composition was, because we've captured little ice bubbles that were year after year deposited on layers of ice in the Arctic and compressed down. Scientists core through the ice and they analyze the amount of carbon dioxide in those little trapped bubbles in the atmosphere, and gives us an idea of what the relative concentration of CO, or what the absolute concentration of CO2 is going back in time. This is 800,000 years. And we see that CO2 has varied from say 180 to 300 parts per billion, and there are various reasons why CO2 is more abundant or less abundant on the Earth's atmosphere. One thing we do know is it does operate within specific boundaries, and it changes very slowly over the course of tens of thousands of years, not as abruptly as we're seeing now. And we do know as well, through other types of data, that the historical temperature of the Earth goes up and down. Yes, climate does change. Yes, climate does change for natural reasons, but it also changes for unnatural reasons. What we have now is something quite a bit different. We have an abrupt departure from these historical norms of amounts of CO2 concentration. Pre-industrial CO2 levels was, let's say, around 280, 300 parts per million. And within the past 100 years, we're seeing it spike dramatically to crossing in 2013 of 400 parts per million CO2. This is unlike any change that we have in the geologic record because of the magnitude of change and the rate of change, changing extremely quickly. If we were to project, we know how much fossil fuel or greenhouse gas emitting things that we put in the atmosphere, and we have a pretty good idea of where we're going. If we were to look towards the end of the century, or even the next 60 years, this is where we would be in 40 more years, at 600 parts per million. So that is a representation of abrupt, unnatural climate change, and that's what I'm here to discuss with you today. Let me go back a slide. As I look at this slide, one thing I'm struck with is the fact that temperature hasn't spiked as much as I would expect it to spike given that enormous spike in CO2. And temperature, as we typically understand and record it, is captured on the Earth's surface. Land surface temperature is most. Most of the energy that's been captured in the Earth's system as a result of the increase in our blanket layer of greenhouse gases is not apparent on the surface of the Earth, but it's been captured by the oceans. The oceans are a great storage of energy. Large volumes of water that can hold temperature and store it over long periods of time. Just like a cold bottle of water will maintain that coldness in a warm room for some time. It has memory. And so we have, through observations going back not terribly long, because there are monitoring the oceans, the amount of monitors we have in the oceans, et cetera, is not as abundant as it is on land, but we do have evidence that the amount of heat that's in the ocean is increasing. We know this from several different lines of evidence. First, we have some ability to monitor temperatures at different levels in the ocean and in different parts of the ocean, but it's very difficult to measure that type of thing. So we look at alternative lines of evidence, and one of them is that we have pretty good data sets on from tidal gauges of the amount of sea level rise in certain parts of the world. And what we notice is that over the past 120 some years, that indeed sea level has risen at about a rate of 1.8 millimeters a year. And this might not spur you to sell your oceanfront property anytime soon, but we do notice one other troubling fact if we break this chart down, is that the rate of a sea level rise is increasing in concert with the rate of temperature rise on the oceans. And what this is telling us is that most of this sea level rise is not due to greater inputs of water into the ocean from melting land-based ice, but rather this is primarily due to the thermal expansion of water in the oceans. Another line of evidence that the oceans are capturing more heat because they're expanding. Another indication of increased heat storage in the oceans is on the amount of ice that we have at the end of the summer in the end of the warm season in the Arctic. This is the trend in the extent, so the total volume of area that is covered in ice in the Arctic. And we know this, but these measurements go back to 1979 because that is the dawn of the satellite era where we're able to make these observations and calculate the total amount of area that's under ice at the end of the summer in the Arctic. And you notice that there's a pretty clear trend that Arctic sea ice extent at the end of the summer is diminishing year on year. And we have further proof through satellite evidence of that. This is September 1994, and we have September 2012. The good news about this is that there's a whole bunch of oil right off of the, and now we can get to it. That's great news. Actually, was it 2 years ago, I believe, a cruise ship did the first Northwest Passage I won't call it circumnavigation, but the first voyage from Seward, Alaska, all the way around to Greenland, I believe, finally executing the famous Northwest Passage through this now ice-free area. Tickets were $150,000 a person, so I didn't get to go. So there's several dimensions about climate change that are important to understand. It's not just about the temperature of the surface of the Earth warming. There's a lot of different things going on that affect, and I'll show you, affect public health in different ways. First of all, just like you would think, global warming implies that climate change is altering the average global temperature over large periods of time versus what the historical average would. But it also changes the frequency of extreme events. So the mean is changed, as is the variance. The other important fact is that these impacts are not even across the globe. Some areas are warming more than others. Some places are getting wetter, some places are getting drier. And so the local context is extremely important. This is a chart that has a few interesting dimensions to it. It is a monthly deviation from the mean going back to 1850. And it shows you 0 degrees in the middle is no change from the climate average. 1.5 degrees is the new measure in which the Intergovernmental Panel on Climate Change, the IPCC, is considering or has considered to be the level at which we engage what they call dangerous anthropogenic interference. The level at which other systems are going to be affected that will lead to positive feedback loops and irreversible climate change. Previously, the number had been 2 degrees C, and now there's evidence and there's a serious debate on whether that level should be 1.5 C. 1.5 C is what the Paris Accord is trying to avoid. This is the level I believe we have to avoid. So this is monthly deviation. You can see it goes up and down, but then it kind of stays around the middle. And then back in the early part of the 19th century, we start seeing the 30s are warm, and then it cools down again. And then at the 1980s is when really you start to see warming happening. And the 90s and 2000, and boom, at 2016, we are that close. That's how quickly it's warming. So that shows you that this is land surface temperatures over the globe. But now let's look at the idea of climate variance. So this is a distribution of northern hemisphere land surface temperatures over a climate average period. When climatologists look at a climate norm for an area, they'll typically use at least a 30-year period. And so what you see here is a normal distribution. You have the middle of the curve shows you the most normal events, that's normal weather, and you have an equal amount of cold weather and hot weather on either side of it. So normal weather is normal because it's the highest peak, right? Now as we shift this into temperature periods 1980 to 90, 1991 to 2001, and then 2001 to 2011, you see two things going on in this chart. First of all, you see global warming. All the observations have shifted to the right. That's what we would expect. We get less cold weather, we get more warm weather. We're also getting extreme weather. It's more hotter on the right side. But the second thing that's happening, which is even as important as this, is that the shape of that curve is flattening. And when the shape of the curve flattens, it means we have less days that are going to be normal in the middle and wider tails of the distribution, which means the extreme events are going to be more frequent. And this is of serious concern to public health because extreme weather events, and this is just temperature, has a serious impact on public health. So normal weather is less normal, is the message in this graph. I mentioned that we have uneven warming, and this is across the United States. You'll be interested to learn that Alabama has actually cooled. It's right up there. We have Alabama and Mississippi have shown over this region, this is 1991 to 2001 average temperature compared to 1901 to 1960 average. And there's an anomaly here. You know, what's going on? And people have talked about this, and many have proposed that what we're seeing here is the effect of a localized cooling on the reforestation of this state versus the way the land cover looked at the turn of the century. in the early part of this century. With widespread farming and cotton, now we have lots of trees, and perhaps that's causing with the aerosols, et cetera. But we'll see that while we have average warming of about 1.9 degrees Fahrenheit, we have 3 degrees in Minnesota and pockets in Colorado, et cetera, that have warmed very significantly. The point here for public health is that it's very dependent upon where you're at, the type of impact that climate change will bring. If you're in Florida or Oklahoma, you're going to experience very different things. And any response to that has to be calibrated to the local climatology. Okay, so now I'm going to shift into a discussion about what all of this about climate change means for public health. And instead of just laying out a whole list of things that are affected by health threats that are affected by climate change, I'm going to categorize them in 3 different ways. I'm going to call these health threats from climate change. And they're not necessarily the what is affected by climate change, it's the how. It's what is it that climate change is doing that is making us sicker or potentially making us sicker. And the first key health threat from climate change relates to extreme weather events. And as I showed earlier, it's not just that weather events are becoming more severe, more extreme, it's that we're seeing more of them. So not only are we getting hot days, but we're getting more hot days. The return period for flooding events is shortening, and we're getting hit time after time after time. What this does, and humans occupy every ecological niche on this planet except for the deep oceans. We are good at adapting to extreme weather. That's why our culture is so complex, and we can manage this. But we have designed our communities, designed our cities, and all of our infrastructure that we have to protect us from weather, and to protect us from extreme weather events in many cases. When the design specifications that we have for our cities is exceeded by the weather that we would expect into a new normal, then we come into problems. And the possibility of those systems failing becomes much more probable. And so when I talk, this category of health effects deals with, because of the increased magnitude and frequency of extreme weather events, the possibility that our systems that we use to protect ourselves, this is transportation, communication, electricity, et cetera, can fail and cascade into multiple health effects and exceed our response capacity for an area. I was talking earlier today, is one example of a massive failure in a response to an extreme weather event. The European heat wave of 2003, as you can see on the left, that chart shows you that summertime temperature, how anomalous it was compared to all the weather previously experienced by Northern Europe. This was centered around Paris, and this event went on. They had never, ever seen anything like this in known history, a weather event like this. It killed 70,000 people in Western Europe over a 2-week period. 70,000 people. That's triple the total deaths we've had from Ebola, more than triple. I cannot, except for some large cyclones, think of a single event that has had this much impact on mortality. This caused a massive upheaval in the French government. I was part of the response team from CDC there and stayed with them for the next year and helped them calculate the measure of excess mortality. This is how many people actually died during this event versus how many people we would expect to die. Because heat wave kills in all kinds of ways. It can cause renal failure, cardiovascular failure, respiratory failure. You can have heat stroke if you're exerting yourself, or you can just get so worn down from the heat after sitting in a hot apartment for a week that you die. And a lot of those deaths, if they're unaccompanied, we don't have a core body temperature, we don't know what they died of. It looks like heart failure, but we don't know what this person was experiencing when they died. So we did, this measure here on the right is confirmed mortality. This is the death certificates that the medical examiner put a code on that death certificate that said exposure to excessive natural heat, ICD code X30. And what we did is we went back and looked at all the death records and all the non-accidental deaths that were during this time period, looked to see if they were compatible. And that number shot up to 70,000 deaths. This was not a failure of, this was not because we can't prevent heat-related deaths. Every single heat-related death can be prevented. We know that. It's a failure of the system to identify a threat, to provide the proper services, cooling, attention to medical care, et cetera. that could have prevented these deaths. We get these kind of heat waves in the United States, but if we experience them, and in places where we experience them, we know what to do. And we build our cities in order to manage that. People live in Florida because there's air conditioning, and Alabama. And that makes it habitable. But when you don't experience an event, you can have a catastrophic event. And this goes along, climate change is not operating in these particular instances independent of other trends. You know, climate change is working along with urban form, with population and demographic change to amplify the risks to all of these things. With urban environments, I'll get to that in a second, cities and climate. Cities have become the dominant habitat for the human species. For the first time in our existence, more people live in cities than not live in cities. That is a dramatic transformation, and that's happened over the last 10 years. And cities represent this physical nature of cities represent a threat that compounds with climate change because it intensifies those exposure. All that impervious surface can't handle the water too well. All of that, the concrete stores heat that it's exposed to during the day and amplifies nighttime temperatures. And as I mentioned, we have more people living in cities than ever before, and the population characteristics of these peoples also represent an increased risk. You know population pyramids, right? So the one on the left is the year 2000, and it kind of looks like a pyramid with a big gut. But the one on the right is projected population distribution in the year 2050. Now this is a challenge. When we see a big capstone at the top of a population pyramid, it's not a pyramid anymore, it's a block, when we have a tremendous amount of people that are over 65 at the top of that pyramid, this represents an enormous challenge for public health. And because elderly persons are more vulnerable to the effects of extreme heat and natural disasters, we have thousands of epi-studies that show that advanced age is a risk factor for bad air quality, exposure to smoke from wildfire events, et cetera. Here we have not just more of this exposure, but we have more vulnerability because of the demographic nature of our population. This isn't just a US trend, but this is a global trend as well. The proportion of population 60 years or over in 1950 to 2050 is going to go from 11 to 22%, double for the latter part of the century. So here we have another co-evolving trend along with climate change that will amplify and make the health risks of climate change even more important than ever. I mentioned that we're now an urban species. So for the first time in 2008, we crossed that threshold, so now we're an urban species primarily. And that urban context is where many of these effects will be felt. The urban heat island is a phenomenon that, like I mentioned, that takes this heat that is exposed during the day and raises it raises nighttime heating. And exposure to heat isn't, as a health effect, isn't something that is limited to a short-term exposure. If you go do hot yoga and you can go step out and cool down for a little bit, you'll be okay. Or if you overexert yourself for a short period of time, you can recover. But if it's cumulative exposure that's most important. If you're exposed to 20, 40, 60 hours of heat, it becomes hard to survive. And nighttime cooling is a great respite from that heat. This is a thermal image, nighttime thermal image of Phoenix, which if you've ever lived out west, you know it cools down dramatically at night. So you might not need the air conditioning at night. Even if it's a 95-degree day, at nighttime it cools off nicely. Well, Phoenix had its record nighttime low in early 2011 of 99 degrees. So essentially the nighttime cooling is gone because all of that energy is stored in the concrete and the asphalt and the buildings, and it radiates around and raises the nighttime temperature. And it can add 7 to 12 degrees just by virtue of the urban form and the way we build cities. So that's going to have to change. We're going to need to find materials and surfaces that are reflective, that have decreased thermal capacity, and re-engineer our cities to accommodate this problem. Because it's not just people's exposure to heat. We're also using more energy to accommodate for this added effect of the urban heat island. Los Angeles uses a third of its entire electricity budget, a third, just accommodating the extra effects of the urban heat island. That's a huge challenge. And if we look at cascading health effects related to these systems, this is a simple example of a power outage in New York City. This is, again, August 2003 was a bad year for the planet. This is the same time that the Paris heat wave hit, but this wasn't related to a heat wave. This was like a normal August, and power went out for a couple of days, and this is what happened to accidental deaths and non-accidental deaths. Just by losing the power in New York City, we had a 120% increase in accidental deaths and 25% increase in non-accidental deaths, absent any natural disaster or heat wave that accompanied it. This is how dependent we are upon these systems, which we must need to re-engineer for the future. And if we think that these effects are discrete and are limited to the event itself, I show you this map, which displays the location of the applicants for aid after Katrina after they left New Orleans. So this is a diaspora. This is a movement, large movement of a population. And this is where they ended up. We had a storm hit New Orleans that destroyed a community and spread them out all over the world. Every time this happens, we send waves of people throughout this country. I did a vulnerability assessment for the city of Austin, Texas, related to climate change. And we went through all of the data and all of the risks and so on and so forth, and kind of gave them the tools for them to kind of brainstorm themselves. And they came back after deliberating, and they said, okay, our biggest threat to our operation this is Travis County, Texas, is hurricanes. And I said, what? Hurricanes? They're like, I said, when was the last time you had a hurricane? They're like, never. And I said, well, what are you talking about? He's like, every time there's a hurricane on the Gulf Coast, we get 10,000 people, 5,000 people, 2,000 people showing up at our door, and we have to provide services for them. We have to get WIC for the kids, we have to get immunizations, we have to do all this. This is our biggest challenge related to climate change because all of these people from hurricanes end up on our doorstep. And it's a huge challenge. So this isn't just, well, that's Louisiana's problem. No, this affects the whole country. Okay, so that was the first key health threat from climate change. The second is not going to make the news like the first health threat. That is very observable and very discreet, and it can make news stories. This is a little more insidious, and it relates to the fact that the environmental exposures that we already experience, the bad air quality, the bad water quality, et cetera, are going to be compounded by climate change. Bad air quality is going to get worse. Wildfires are going to become more frequent and worse in air quality. And it adds to the cumulative death by 1,000 cuts or morbidity and mortality by 1,000 cuts that are already faced by populations, especially those most vulnerable locations and populations that are already experiencing these things. The folks that live close to the interstate highway already have bad air, and that air is going to get worse. And it's the most vulnerable populations that live close to the highway because they can't afford to live where the air is clean. This is, again, one of those things that's directly affected by warm temperature. This is ozone days. And just showing Atlanta and New York that as the temperature increases, the potential for the photochemical reaction that happens between smog precursors in the presence of sunlight to produce ozone increases. So more hot days during the summer doesn't mean just more hot days, it means more bad air quality days. And when we get hot days, they're typically stagnant air masses. That ozone pollution builds up in the afternoon is going to increase, and it has been increasing. The number of ozone exceedance days in Atlanta and other parts of this country are increasing, and it's not something that's terribly flashy or something that's going to get a lot of attention, but it will lead to increased hospitalizations. This is a study done by a colleague of mine modeling, given the number of hot days in the greater New York area that are expected by climate models in 2020. This is next year. This study was published in 2011. And this is a short period of time, 2011 to 2020. What's the increase in numbers of pediatric ED visits for asthma because of these ozone days? That's going to send kids to the hospital. We have up to 10% increase in pediatric ED visits as a result of this temperature. Again, it would take an epidemiologist to figure out this trend, to uncover these trends, and to report on this. But as we start poking around into all these little health effects, we see that it's going in the wrong direction. One other way in which a current stress, aeroallergens or allergic rhinitis, is in very strange ways affected by climate change. This is a really fascinating study done by a colleague of mine at USDA, Lou Ziska. And he wanted to understand, he knew that the plant on the upper left, this is ambrosia or ragweed, is stimulated, as many plants are, what'd I do? Okay, is stimulated by CO2. So certain plants, if you add CO2 to their environment, they tend to grow bigger biomass, they tend to grow quicker. It's kind of like steroids for plants. And ragweed is one of them that is affected by excess CO2. And remember I mentioned urban heat islands, we have this island of heat that's trapped. Well, urban areas also have something called a CO2 dome. That if you were to take, I showed you the measurement of CO2 that's a background CO2 in the planet that's actually collected on Mauna Loa. If you were to take a CO2 measurement on Mauna Loa, you'd get 412, 415 parts per million. If you were to go to downtown Atlanta, you would get 500, 520, maybe somewhere around there, because there's a lot of cars, there's a lot of sources of emissions, and the density of that CO2 in Atlanta is much higher. So my colleague, what he decided to do is took ragweed, 3 ragweed plants, they were clones of each other, so genetically identical. He planted them in plots that had the identical soil, and it was on a latitudinal transect from rural Maryland, it's same latitude, so it gets the same temperature and sunlight, et cetera, and from rural Maryland, suburban Baltimore, and inside Baltimore. And he measured how much pollen that these ragweed plants, identical in every aspect, produced controlling for CO2. And what he noticed was that the urban plot, which had a background CO2 of around 500 parts per million, produced 12,100 pollen grains per cubic meter of air. That's the big dot on the left. Versus the suburban and rural, which were exposed to around 400 parts per million, that produced 32 and 2,300 pollen grains per cubic meter of air. So one single plant quintupled in its production of pollen just as a result of being exposed to this extra CO2 in the urban environment. And we at CDC have done studies looking at trends in pollen production going back 25, 30 years, and have seen dramatic slopes, very steep slopes in the amount of pollen that's being produced. This is probably for 2 reasons. Longer growing season, we're getting an earlier frost, and earlier last frost, later first frost, but as well as CO2 fertilization in urban areas. It's producing more pollen. And pollen, you might say, okay, big deal, take your Zyrtec. But it's an important drag on our health. It sends people to the hospital if they have COPD, if they have respiratory conditions. It does matter to many people, and it costs us a lot. Economic treatment costs are $11 billion, annual economic cost $5.4 billion. I have skipped work because, not skipped, taken the day off, because I've had bad allergies. I mean, you just can't think. And so we expect more of this in the future. So really kind of subtle impact on climate and health, or climate change, that we have to be wary of. And we're seeing that the length of the pollen season, so not just the amount of pollen, but the length of the season is increasing as well, especially in the northern latitudes, up of Canada, et cetera. These are the increases in the pollen season, 26 days lengthening up in, I think that's Manitoba, which is, again, adding to this effect. And this is due to warmer temperatures. And we're seeing this, again, in other ways. If you're a gardener, you know what these plant hardiness zones. If you look at the shift in hardiness zones from 1990 to 2012, you'll see that, gosh, now this is real ecological change. This is shifts that will allow not only plants to move if they are able to get up and walk or spread north, but animals too. So there's an ecological shift going on here that we need to pay attention to as well. Incidentally, increased CO2 also gives poison ivy more of its allergenic compound, urushiol. So we're going to have greater amount of this oil on poison ivy. So we have super poison ivy to worry about in the future. One of the more dramatic impacts as a result of changes in precipitation and especially drought, but in addition, other effects that are related to things like milder winters is the increase in wildfire activity. We're seeing a tremendous change in the length of the wildfire season and the extent of wildfires. Now, a lot of this has to do with forestry management practices. It also has to do with invasive or pests like pine bark beetle, which are now able to overwinter in greater numbers because of milder winters and are able to, in greater quantity, affect forest health in a much more substantial way than if their numbers had been controlled through hard winters, because that's primarily what keeps these pests under control. And we're seeing, whole mountainsides. If you've ever driven over Loveland Pass in Colorado, you will see whole mountainsides of brown dead trees, which are ready to catch on fire. And wildfire smoke has a tremendous impact on public health. We see that an increase in 10 micrograms per cubic meter of coarse air pollution, PM10, results in approximately 1% increase in non-accidental mortality. And that's not just for the firefighters or the people right in those communities. This is communities 200, 300, 400 miles away downwind that are experiencing this wildfire smoke coming over their community. So every time you go to San Francisco and it looks a little hazy and wildfires are up in Napa, you can expect 1% of the population to have the excess mortality of 1%. In some cases, in Australia, they've recorded up to 5% increase in overall mortality related to brush fires. Depends on what's being burned. We have, as a result of intensification of drought and increased convective activity around the monsoons, I think I got that right, Jim, we have a greater potential for these large dust storms called haboobs being formed. And these are kind of a really heavy burst of air associated with the monsoon season. And what it does is not only does that thing just look scary and it's coming down on you, you're more likely to be in trouble and increase or decrease air quality, but we also have the potential spread of an infectious disease. This is a fungal disease called coccidioides mycosis, and it is dispersed primarily through winds or dust storms around these events and other types of dust storms, or smaller dust storms. But we see that once these haboobs come through, this is a fungal spore that lives in the soil. It's abundant. It's more transportable when we have drought conditions. And these storms come and aerosolize it. And if people get the spore in their lungs, they come down with what's called valley fever. And we're seeing the spread in valley fever as the Southwest is increasingly drying, and more cases showing up in our public health surveillance figures. On the other end of the equation from drought, we have a fundamental change in rainfall that is worrisome. Increasingly, while wet places are getting wetter and dry places are getting drier, there's a change in the nature of rainfall that is going to be really challenging, and that is that more rain is coming down in heavy downbursts versus gentle soaking rain. Imagine impervious surfaces in cities and trying to manage all that rain. It becomes very difficult to manage water in a way that's safe for public health. And if we look at the link between heavy precipitation events, so you can see on the map on the right is from the National Climate Assessment Report, and it's really tiny up there. But the takeaway is that the frequency of very heavy precipitation events, heavy downpours, is increasing in general across the United States, and varying, if we break it down into climate region, it's changing in various rates. But if we look back at the association between heavy rainfall and waterborne disease outbreaks that we have identified and done surveillance on, we know that 2/3 of all waterborne disease outbreaks were preceded by rainfall above the 80th percentile, which makes sense, right? You have a heavy rainfall event, you mobilize all kinds of junk on the surface, from farms to pesticides to whatever's on the surface, contaminants, and it becomes a challenge to manage the water quality as a result. And importantly, heavy rainfall events are projected to increase into the future more frequently. Actually, the biggest waterborne disease outbreak in U.S. history was this cryptosporidium outbreak in Milwaukee in 1993. It too was preceded by the heaviest rainfall in 50 years. And this highlights, again, deficiencies in our infrastructure when these drinking water systems are built for the weather of the 20th century, and now we have the weather of of the future, we're going to see limits to the ability of these systems to work. And what happened in this case was that the design of this drinking water system had the intake, which is, you can see it on the right on the map, was thought to be far enough away from the discharge of the river for it to not be contaminated by whatever was coming out of this river. And if you've ever been to interior Wisconsin, there's a lot of farms, there's a lot of cattle, there's a lot of things out there that you don't want in your water. And this storm, being so big and such magnitude, made a plume of a discharge plume that got in the intake. And cryptosporidium is not sensitive to chlorination, so it got 400 people sick, killed 54, and cost a boatload of money. And highlighting a key vulnerability from heavy rainfall events and drinking water quality. Okay, so that category of health effects is things that we already deal with, right? These aren't new, but there's going to be more of them, and it's going to be a problem that we need to manage. But the third key health threat from climate change is the fact that we're going to have some surprises, and we better be ready for them. And you cannot perturb these ecological systems to such a grand scale without having some surprises. I'm going to speed it up a bit because I only got 2 hours left. First of all, harmful algal blooms are infected by increased temperature. The map on the right shows distribution of a formerly tropical harmful algal bloom, Cylindrospermopsis, that we now have in Florida, and it's in our freshwater lakes. And EPA safe water doesn't require the identification of Cylindrospermopsin in its water. So that's a problem that we need to understand. We have these tropical organisms in Florida already. Ciguatera fish poisoning was formerly restricted to the Western Pacific and the Caribbean. And I did a study showing that we indeed have it in the Gulf of Mexico now. So if you eat a grouper caught in the Gulf of Mexico, there's a chance that you might become sick. And this is a result of increased sea surface temperatures and this organism moving, because these things can move. Lyme disease is projected and is moving in its distribution as a result of warmer wintertime temperatures that increases tick density, a few more ticks survive the winter, and a number of other factors. This is a modeling study showing where it might move to, but if we actually look at, 2080, it's going to go all over the place. But if we go to actual CDC data on the case distribution of Lyme disease in the United States, this is 1996, this is 2011. And do that again. And it's now up in Maine, we have it in southern Quebec, we've got it all up in the Great Lakes area, and it's a big problem because Lyme disease, which was thought was the third most common disease in the list of notifiable disease by the CDC, right? Third behind chlamydia and gonorrhea. And we thought there were around 34,000 cases per year. A colleague of mine did a study recently looking at private laboratory tests for Lyme disease to see how many positive tests are we missing here that people aren't reporting to CDC. The real number of Lyme disease cases is close to 350,000 in the United States, would make it number one. The biggest threat coming from climate change, though, I'm about to propose, has nothing to do with weather or climate. There's been a lot of discussion about food security under climate change, changes in precipitation, increased temperature, worker productivity under warmer conditions, et cetera. And even some rosy news about the impact that increased carbon fertilization would have on agricultural productivity. But what we've what we have been startled to discover recently is that and I mentioned ragweed is sensitive to CO2 fertilization. So are many other plants, including plants that feed the world. These C3, C4 plants, barley, rice, wheat, soybean, etc. If we raise these plants under elevated CO2 levels, right? This is independent of any weather change, no temperature, everything's normal with this. But just increase the CO2, we noticed that the quality of the plant decreases. The protein concentration, this is a map just showing the protein concentration of these crops grown under excess CO2 levels. And we have 15 to 20% decrease in crude protein concentration in all of these crops raised under elevated CO2 levels. Imagine a planet with 9 billion people at the end of the century and CO2 levels that would cause these types of effects on the crops that feed the world. and feeding 9 billion people with crops that are 20% less nutritious, less protein. And this doesn't just affect crude protein, it affects micronutrients as well, and iron concentration and zinc concentration, et cetera. This is, again, nothing to do with weather. This just has to do with the effect that carbon pollution has on these plants. This, to me, is intractable because we can adapt to all the other stuff. We can build better water distribution systems. We can retreat from the coast. We can build better cities. What do we do about this problem? And this isn't limited to plants in the oceans, plants on land. If we acidify the oceans and the calcareous organisms that rely on less acidic conditions in order to make their exoskeleton. This is the food base of the oceans, the zooplankton and phytoplankton. If those are unable to survive in high acidity conditions, what happens to the food base of the oceans? Yeah, mental health problems. That's what happens. And we're seeing that these mental health, Greta, everybody knows Greta, right? And she is, does everybody know Greta? Everybody knows Greta. Greta's the young girl in Sweden who is profoundly, or she's Netherlands, right? She's Dutch. Profoundly affected by climate change, so much so that she's become a global icon for the young. And there is not just limited to her. This study on the upper right says that 3/4 of 11 to 14-year-olds worry about climate change compared to 41% who are worried about going out with someone. Now that's a tough competition for a 14-year-old. You're worried about climate change to the degree that we've even coined a new term that's related to large-scale environmental degradation, solastalgia, that people, living in a time where people like me telling you guys the state of the planet, it gets people bummed out. And these are mental health conditions related to PTSD after storms, but also understanding that this is a massive challenge that's going to affect our world. We again have cultural resources that are going to affect people's health, and a number of things, temperatures, extreme weather, rising sea levels, all add to a whole variety of exposures, from air pollution to water and food supply impacts, extreme heat. These are exposures that will again have a tremendous impact on a wide variety of health outcomes that will be very challenging for us to address, and ought to be, as the Margaret Chan, the Director General of the World Health Organization, said, is the single defining public health threat of the 21st century. So thank you.